Welcome to Passport and MyCare Ohio Waiver New Provider Orientation. The following slides will highlight the key areas important for all certified passport providers. Please remember that each passport service has additional service-specific rules that must be followed. Providers are responsible for training their staff to follow passport rules and should contact their assigned provider relations specialist with questions. Ohio has 12 area agencies on aging that represent all 88 counties. Sometimes they are referred to as PAAs or Passport Administrative Agencies. The Central Ohio Area Agency on Aging, also known as COAAA, is in PAA 6 and consists of an 8-county region: Delaware, Fairfield, Fayette, Franklin, Licking, Madison, Pickaway, and Union. Certified providers must identify which counties they would like to service and ensure they have staff available to service those areas. COAAA is operated under the City of Columbus Recreation and Parks Department, and providers enter into a contract with the City of Columbus as part of passport certification. Providers interested in becoming a certified passport provider and remaining certified are required to comply with rules established by the Ohio Department of Aging, or ODA. Please note that these rules apply to passport individuals and MyCare Ohio individuals. Rules can be accessed by visiting the Ohio Department of Aging website, www.aging.ohio.gov. Access the rules through the drop-down entitled For Professionals and select Administrative Rules. Passport waiver rules are found within Certified Provider Requirements. It is there you will find the certification requirements required for all providers who service individuals through Passport and the unique requirements for providing specific services such as personal care, home-delivered meals, and transportation. That's right. Each service has specific rules to follow in addition to the general certification requirements all providers agree to follow. Within certified provider requirements, you can also find rules regarding ownership changes, the structural compliance review process, and the disciplinary actions that may be imposed. In addition, we encourage providers to sign up for email updates to be informed of rule changes. Please visit www.aging.ohio.gov/news to sign up. Lastly, all providers are assigned a provider relations specialist. Please make sure you know your provider relations specialist's phone number and email address. It is your responsibility to ask questions regarding certification rules and service specifications. The list of current provider relations specialists is available on the For Providers section on our website, www.coaaa.org. Changes in ownership, contact information such as email addresses, phone and fax numbers, tax ID numbers, or the opening of additional offices must be reported to your provider relations specialist. Your provider relations specialist will advise you of any needed documentation to process the changes and any actions you must take. Failure to report changes may negatively affect referrals, your ability to provide services, and to receive payment. Certified providers are subject to several types of reviews to ensure compliance with rules established by the Ohio Department of Aging. An annual structural compliance review must occur at least annually from the date of certification for many passport services, such as personal care, homemaker, adult day, and home-delivered meals. Some services, such as home maintenance and chores, personal emergency response services, home medical equipment and supplies, home modification, and transportation, may occur at least once every 2 years after the first 2 years of service. The structural compliance review process will also include a sample unit of service, also known as a billing audit, to ensure services were delivered and billed according to requirements. Providers with multiple office locations or business sites are subject for in-person reviews by provider relations staff. Depending on location, a desk review may be conducted in lieu of an on-site compliance review. Finally, provider relations and/or the Ohio Department of Aging may exercise the right to conduct an event-based or unannounced on-site review of a provider at any time to evaluate any complaint or concern and to determine whether the health and/or safety of one or more waiver individuals is at imminent risk. When areas of noncompliance are identified during a compliance review, providers will receive a summary letter that addresses the evidence of compliance, also known as EOC. This may also be referred to as a plan of correction that must be submitted back to your provider relations specialist. EOC addressed in the summary letter is due within 45 business days of mailing. If there is conduct identified that poses a potential threat to the health, safety, or welfare to the waiver individual, a Level 1 disciplinary action will be issued. The Level 1 disciplinary action is a separate letter that is sent certified to the provider and also by fax. Evidence of compliance addressed in the Level 1 disciplinary action is due within 7 calendar days of mailing. You may choose to submit your evidence of compliance by email, fax, mail, or hand-delivered to the COAAA office. Please include a cover letter that identifies the provider name and identify the attachments included. Please do not assume that your provider relations specialist will know how you intend to apply the evidence of compliance. Your provider relations specialist will review the submitted documentation and contact you to advise whether the documentation was approved or if additional information is needed. As highlighted in the previous slide, disciplinary actions are issued when the conduct identified poses a potential threat to the health, safety, or welfare of the waiver individuals the provider services. Often, noncompliance relating to the criminal background check requirements and worker qualifications will result in a Level 1 disciplinary action. Additional noncompliance within each specific service may result in a Level 1 disciplinary action. Disciplinary actions can be issued anytime the Provider Relations Department is made aware of health and safety violations, such as with an incident report. The Level 1 disciplinary action letter is also sent to the Ohio Department of Aging for review, and ODA is notified when evidence of compliance has been submitted and approved. Once evidence of compliance has been approved, the disciplinary action is considered lifted. The Ohio Department of Aging has authority to issue progressive disciplinary actions. In the event that ODA issues a disciplinary action, the provider will work directly with ODA to meet compliance. The rules for criminal background checks are available through the Ohio Department of Aging website, www.aging.ohio.gov, within Ohio Administrative Code 173-39-1 through 173-39-10. These rules are identified as background checks for paid direct care positions. All applicants or employees who have access to waiver individual records and/or have direct face-to-face contact with waiver individuals must have a criminal background check completed at the time of hire. This includes owners, management, office workers, and staff working directly with waiver individuals. Prior to hiring an applicant and completing a fingerprint check, the provider must review the 7 free databases specified in OAC 173-9-03 to determine that the applicant is not listed unfavorably on any of the websites. If the applicant is listed unfavorably on any of these websites, the applicant is not eligible for hire. These checks must be printed and include a date to confirm completion as required. The provider must initiate the BCI request using one of the 6 reason codes listed in this slide. The provider may not accept a BCI letter report that was sent directly to the employee's home address or to another employer. If the applicant has not resided in Ohio continuously during the 5 years immediately prior to hire, the background check must include an FBI check in addition to the BCI check. If the applicant has had a BCI check done for another agency within the past 12 months, the provider may request a re-verification report for that applicant. The re-verification results must be sent to the hiring provider. You must ensure the previous BCI check was conducted using an approved reason code. Otherwise, the re-verification will not be accepted. A provider may conditionally hire an applicant for 60 days while waiting for the BCI results letter. If the results letter is not returned within 60 days, the worker must be released and cannot service any Passport or MyCare Ohio waiver individuals. If the BCI results letter returns with a disqualifying conviction or multiple convictions, the provider must determine if the employee is eligible for continuing employment by applying the requirements of OAC 173-9-07 and reviewing tiers and exclusionary periods. Please contact your provider relations specialist to obtain additional assistance with interpreting the BCI results letter. All employees providing direct care, except home-delivered meal drivers, must have a new criminal background check every 5 years. This includes both the database reviews and fingerprint checks. A provider may choose to have an internal policy that requires criminal background checks more often than every 5 years. All applicants and current employees must be listed on a roster that contains the information specified in OAC 173-9-08. This image is an example of a criminal background check roster, and the columns designated with an asterisk are required according to rule. Please consider maintaining the roster on an annual basis. For example, staff hired in 2019 will be listed on the 2019 roster. You will then list the workers again on the 2024 roster when you rerun the 7 database checks and initiate a new BCI results letter to be in compliance with the every 5-year requirement. Services billed to Passport utilize Direct Data Entry, or DDE. This system allows providers to electronically transmit bills and receive correspondence via the Internet. In order to utilize this data transmission process, the provider will need a computer system with Internet access and an email address. A manual and computer-based training videos have been developed and made available on our website. To access these items, visit www.coaaa.org, click on For Providers and Billing. After you have begun providing services, please email passportbilling@coaaa.org to request your login ID, password, and access to the practice area. An alternative to DDE is Electronic Data Interchange, or EDI. If you wish to explore this option, please have your Information Technology Department contact the Ohio Department of Aging. To ensure error-free billing, you must have the timesheet or service verification document in hand. Do not bill according to the service authorization or the schedule without referencing the original timesheet or service verification document. Failure to retain service verification documentation according to rule requirements may result in a recovery of funds already paid to the provider. Services cannot be provided and billed within the same month using DDE. Example, services provided in February must be billed on or after March 1. Please note that it may take 3 weeks to receive payment after invoices are submitted, and direct deposit is not available at this time. EVV, or Electronic Visit Verification, is an electronic system that verifies when provider visits occur and documents the precise time services begin and end. In most cases, a signature or voice verification from the individual receiving the services is also captured. EVV does not replace the requirement to verify services as required in Passport rule, such as maintaining timesheets or other documents to verify service delivery. The Ohio Department of Medicaid has contracted with Sandata Technologies to provide Ohio's EVV system at no cost to providers or individuals. Sandata provides devices, an app, telephony, an online system, and 24/7 customer support. The Ohio Department of Medicaid is implementing EVV in phases for passport services. Please visit the Ohio Department of Medicaid website for information on EVV requirements and to register for training as a new provider. You may also contact the EVV Provider Hotline by calling 1-855-805-3505. The provider has a responsibility to report significant changes to the case manager within 1 business day after the provider is made aware of any change that may affect the individual's service needs, including one or more of the following, such as the provider does not provide an authorized service at the time or for the period of time authorized by the case manager, the individual moves to another address, the individual's repeated refusal of services, or if there is a significant change in the individual's physical, mental, or emotional status, environment, or safety. Please consider how you intend to document and retain communication with case managers, such as maintaining a communication log within the waiver individual's record. Communication records can be retained electronically as long as they can be readily available upon request. Providers must ensure that waiver individual information remains confidential at all times. In order to protect information, providers may choose to send emails to case managers via encrypted email software. Providers who do not use a mechanism for creating secure emails should leave voice messages, send faxes instead of an email, or send emails using the waiver individual's initials and Medicaid number or the unique passport identification number, often referred to as the PIMS number. COAAA case managers will send emails securely using encryption software called Barracuda and will require providers to create an account to access these emails. In the event a provider violates confidentiality protocol, you will be contacted by your provider relations specialist. As a new provider, please consider using a generic email address for referrals such as 123homecarereferrals@abc.com instead of an email address associated with a specific employee in the event this employee is no longer employed by the provider agency. Passport is a person-centered program and providers are selected based on individual choice and lowest cost depending on the service. If the waiver individual does not have a provider preference, all providers within the specific service will receive an email from the Passport Referral Coordinator and have the opportunity to respond. Please note the referral process is first reply, first served, and Passport cannot guarantee a certain number of business or referrals. As a reminder, requests to change providers should be directed to the case manager and should come from the waiver individual receiving services, not the agency. If a waiver individual wishes to receive services from your agency, please direct them to contact their case manager to discuss their request. When a provider is selected for a service, the provider will be sent a service authorization or service plan. The service authorization may be several pages and list other Passport providers and services. The top portion of the service authorization will identify the waiver individual's name, PIMS identification number, and the case manager's name. In this example, the service Enhanced ADS or Adult Daycare has been authorized and the selected provider is All Star Adult Daycare. The service period begins February 1, 2019 and ends January 31, 2020. The case manager has authorized adult day services to be provided on Mondays, Tuesdays, and Thursdays. This waiver individual is also authorized to receive daily personal care services from Exceptional Home Health Agency. Please note that personal care services are authorized in 15-minute units. The service authorization should be an accurate reflection of services being provided to the waiver individual. Providers should report issues and concerns to the case manager and direct waiver individuals to contact their case manager to request service changes. For service verification, such as on timesheets, the expectation is for the waiver individual to sign documentation and use their complete signature. In the event the waiver individual is unable to sign with a complete signature, the case manager may designate an alternate signature such as initials, stamp or mark, or electronic signature that represents the waiver individual's acknowledgement. The case manager may also designate if another person, such as an authorized representative, is permitted to sign on behalf of the waiver individual. The case manager will send the provider documentation that indicates the designated signature format. If you observe a change in waiver individual's signature, please contact the case manager. As a reminder, if you are a provider currently required to use EVV, EVV does not replace the requirement to verify services as required in Passport Rule, such as maintaining timesheets or other documents to verify service delivery. This is the Passport Service Information Sheet and will often accompany a service authorization or service plan sent to the provider by the case manager. This is an example of how a case manager can designate the expected form of waiver individual signature. In this example, the case manager has indicated the waiver individual is unable to sign verification with a full signature, and the waiver individual is approved to initial documentation in lieu of the full signature. As a reminder, the topics covered in this orientation do not fully encompass the entire content of rules, but rather are highlights to assist providers. Please remember that each Passport service has service-specific rules that must be followed. Providers must educate themselves regarding the rules and are required to apply them correctly. Providers are responsible for training their staff to follow Passport rules and should contact their assigned provider relations specialist with questions.